So 2020 candidate Andrew Yang has a new campaign ad out. Now, before I even say anything else, I want to play this ad for you and then tell you what's wrong with it.
The work of so many caregivers goes unseen. Whether it's caring for parents or, like me, staying at home with young boys, one of whom has special needs. If my husband, Andrew Yang, is president, he'll fight for Medicare for all with mental health coverage and for $1,000 a month for every American, including caregivers, because Andrew values what we do, not just for our families, but for our nation.
I'm Andrew Yang, and I approve this message.
So, great ad, right? Little problem. Andrew Yang does not support Medicare for all. He continues to claim that he does, and he doesn't. And this is a new ad. So I initially did a story on this last week now, I think, discussing that Andrew Yang doesn't support Medicare for all, but he had some old ads that were saying that he supports Medicare for all. Well, so like my assumption was that, Andrew Yang changed strategy. I mean, it's a horrible idea to change strategy away from Medicare for all, as we've seen with Kamala Harris. When she backed off Medicare for all, she lost all her support. Elizabeth Warren released her ridiculous two-piece plan to somehow get Medicare for all, but not really, because it's more of a public option at first. So she lost support after doing that. Andrew Yang backing off Medicare for all. But no, this is a new ad. And he is knowingly doing this while he's pretending to still support Medicare for all while he doesn't. So here he is recently on ABC This Week being questioned on this.
Let's turn to your healthcare plan, because you've just released a new healthcare plan, and I'm a little bit confused about where you stand. First, I want to play clips from two of your ads where you talk about healthcare.
We need to move towards a Medicare for all system where every American has access to quality and affordable services.
His ideas are a blueprint for a new way forward. A healthcare system with Medicare for all.
But I've looked at your healthcare plan. In fact, I've got it right here. And this plan does not call for Medicare for all. In fact, it doesn't even have a public option. So why the dissonance here?
We need to move towards universal health care that's high quality and nearly cost-free for Americans around the country. But reality is we have millions of Americans who are on private insurance right now, and taking those plans away from them very quickly would be untenable for many, many Americans.
Why? Why is that untenable? So apart from the obvious fact that Andrew Yang is lying in his campaign ads and is not admitting to it here, why is it unattainable to replace your private insurance with a single payer system? There's nothing wrong with that. People would have more comprehensive coverage under Medicare for all and zero out-of-pocket expenses, no copays, nothing. What's unattainable about this? Like this, there is no coherent argument against a Medicare for all single payer system. I'm a Canadian. I live under a single payer healthcare system. There is no argument against it. There is no argument moving from. I mean, this is why there is no conservative. We have a conservative party in Canada, obviously, but the idea that they would ever run on getting rid of our single payer system is just so completely absurd. They would never dare do that, and they haven't done that because they would be completely wiped out of Parliament. Our single payer system is incredibly popular. The only issues with it is that there isn't enough put into it. So we should also have dental care universally guaranteed to us, and we don't. Pharmacare should be universally guaranteed to us, and it's not. But the issue with it isn't that we don't have enough private insurance in our system. That's absurd. So this idea that, 45,000 people a year died due to a lack of access to healthcare, but that's perfectly fine because it's unattainable to, it doesn't make any sense to move to healthcare, to a Medicare for all system right now. Too disruptive. It would change too many things for people. Maybe it would save lives. Maybe people that can't afford healthcare right now would actually be able to get healthcare and preventative care on top of that, preventing them from having more serious issues in the future and being and putting even more pressure on the system when it comes to cancer treatment, for example. So if you catch things early, it's a lot cheaper on the system than the current system is right now. There is no argument against a Medicare for all system. The vast, vast majority of people would be paying a lot less through their taxes under a Medicare for All single payer system than they currently pay to a private employer. And not even to mention, like, again, the out-of-pocket expenses. So you think you have health insurance, but then you go to the doctor, oh, you got to actually give them an extra $1,000 or whatever, like $5,000 before you actually get treatment because you need serious treatment. Like, what a stupid system. It's such a stupid system. People that think they're covered aren't actually covered. And not to mention the other side of all the benefits. Under your current system, under the American system, many people are stuck in their jobs because they're afraid of leaving. They have great health insurance through their employer, but they hate their job. But they have great health insurance, so they stay with it. Under a single payer system, you are now free to go back to school, maybe start a business and hire people in a small business and not have to worry about getting them health care because they have health care guaranteed to them through a single payer system. Endless benefits. You have freedom of choice of doctor, of provider. I go to any walk-in clinic anywhere because we live under a single payer system. I have my own doctor, but say she's not available today. I want to make the appointment. Okay, fine. I go to any walk-in clinic, see whatever doctor there, get treatment. And by the way, when it comes to my appointments, I make same-day appointments. I wake up, I don't feel well, I call my doctor. That same day, that afternoon, I can go and see her. So this is under a single payer system that apparently is too disruptive to move to. But let me continue this dishonesty here.
To me, the goal of the government has to be to demonstrate that we can outcompete private plans and then push them out of the market over time. And that's what we're proposing.
Also, that's absurd. This idea that a public option, or first of all, Yang doesn't even support a public option. Pete Buttigieg actually has a more progressive healthcare plan than Andrew Yang does. But this idea that, oh, we'll slowly move to a Medicare for All system and slowly phase out private health insurance. No, like, you take that approach, like the Elizabeth Warren approach, for example, where, you know, in the first year you pass a public option, and then 3 years later, right before your next election, somehow you're going to pass Medicare for All. You are giving private healthcare companies, private insurance companies, pharmaceutical companies, you're giving them 3 years to fight you on Medicare for All. You give them a 3-year window to create a whole new round of BS to fight you on when it comes to this issue. I mean, it's absurd. You have, and if you do have a public option, what ends up happening is the private insurance companies can then drain the public system of resources by offsetting all the sick people onto the public system while they have all the healthy people. And then they can turn around and go, hey, look at that. I guess Medicare for All won't work because we just drain the system of resources by offsetting all the sick people onto the public system. I guess you got to go back to private insurance now. Like, just to hear this come out of Andrew Yang, who was supposed to be some anti-establishment candidate, who's supposed to be fighting for something else, something different, fighting for people over profits. Andrew Yang, if you didn't know, raises money from wealthy donors as well. He's not just grassroots funded. So it may indicate why he has a shift on this, has a little shift on this issue from where he was when he first began this campaign. But now it's getting to the point where he's straight up lying about what he thinks when it comes to healthcare. If he had a shift and it was an honest shift, fine. You don't support Medicare for All anymore? Fine. Then say you don't support Medicare for All. Don't put it in your damn ads. But you put it in your ads, you are misinforming people on purpose because you know Medicare for All is popular. Even though you know you won't fight for it, you will put it in your ads to get their votes. It's disgusting. This is typical standard politician bullshit.
But I'm confused. Your ad is explicit. Your ad says Medicare for All. Your plan is not Medicare for All. It's not even Medicare for some because in your plan there's not even a public option.
Our plan is to expand a universal health care system to all Americans. Medicare for All is not the name of a bill. Medicare for All is universal health care for...
Medicare for All is the name of a bill. There's a bill in the Senate, one in the House. Medicare for All is Medicare for All. What else needs to be said? It's obvious to everyone what Medicare for All actually means. Now he's trying to use the name and say, well, what I want is also Medicare for All. Even though it's not, I'm just lying to you and I know it's popular, so I'm going to use the name and say that it's Medicare for All when I know it's not. And just so happens my money's coming from everywhere, not just the people. let's look at his actual plan, because even on his website, he does this. So let's zoom in here, because he brings up Medicare for all. To be clear, I support the spirit of Medicare for all. The spirit of Medicare for all. As I said in my other video on this, this is just a way of saying I don't actually support Medicare for all, but I know you support Medicare for all, and I want you to support me. So I'm going to say that I support the spirit of Medicare for all. So I lie just enough that I can get away with pretending that I support Medicare for all, even though I don't. And have since the first day of this campaign. I do believe that swiftly reformatting 18% of our economy and eliminating private insurance for millions of Americans is not a realistic strategy. Yes, it's more realistic to allow people to die because they can't afford healthcare. That's what's realistic to Andrew Yang. So we need to provide a new way forward on healthcare for all Americans. You go down to his plan here. This is his plan. Control the cost of life-saving prescription drugs, invest in technology, change the incentive structure, shift our focus, educating ourselves on preventative care, ensure crucial aspects of well-being, including mental health care, people with disability, diminish the influence of lobbyists. Nothing here. There's not even a public option in this. Like, this is Andrew Yang's Medicare for all. Not Medicare for all, the spirit of Medicare for all. I mean, we can't actually do Medicare for all because that would actually help people. But I support the spirit of Medicare for all because I want your vote. Thank you. Just totally dishonest. And if you're still on the Yang train, it's about time to jump off. He's not who he pretends to be. Straight up. I mean, I'm not sure why you would support. UBI is kind of the only thing that sets him apart from anybody else in the race. But this is my thing on UBI, Universal Basic Income. So I've been a supporter of it for a while because I looked at the studies. There's studies in Canada, studies in the UK, examples where they've implemented it in a limited capacity in certain districts, certain counties, certain cities, and it worked out well. Here's the problem. What happens when everybody in the country gets $1,000? When it's not just a county or a district or a city, but it's every single person. Do you really think that rent isn't going to go up? Do you really think that these companies are going to charge people the same amount of whatever service or product that they've been charging you currently when they know everybody in the country has an extra $1,000? So it's different when it's a county or a city or a district because that small area is not going to have a massive impact on the rest of the country. Those people living in that city with that basic income in this study get to still enjoy life the way it is for everybody else, except now they have an extra $1,000. So it's not going to have an impact on the economy because this little city has it. But when the entire country has an extra $1,000, I imagine that's going to have an impact. So even if, and on top of that, even if you're like, David, whatever, I don't believe you. Okay, fine. Do you think Andrew Yang's actually going to win when he's polling right now at 3% nationally? This race is coming down to Biden and Bernie. Even Elizabeth Warren is barely hitting 15%. You need 15% of the vote in a state, in a primary state, to get delegates. Elizabeth Warren may even be missing out on delegates, even though she is a top 3 candidate right now. Pete Buttigieg missing out on delegates because he's also barely hitting that number. Now, in some of the early states, he's hitting that because he's putting a ton of ad money into those states. But otherwise, I mean, his support nationally, Pete Buttigieg, is like 10%. So this race is coming down between Joe Biden and Bernie Sanders. At some point, you have to choose a candidate. Who do you actually think will fight for you? So at this point, we're getting down to the voting states here. The primary is starting. You have to back a candidate that can actually, that not only will fight for you, which Bernie Sanders will, he has a 40-year record of proving that, but someone that can actually win. Andrew Yang is not going to win. I'm sorry. So reevaluate and understand that even if you, for whatever reason, love Andrew Yang, you can recognize here that he's lying about his support for Medicare for all. He does not support Medicare for all. And he also has no shot at actually winning this primary race. Sorry, Yang Gang. but had to be said. And look, a lot of Yang supporters, I'm sure, are nice people. Like, I have nothing against Yang supporters. But like, it's time for a wake-up call. Like, we're getting down to it. And same with Warren supporters. Like, if you're a Warren supporter who's a progressive, even though I think a lot of her support right now is really like the Hillary Clinton kind of carryover. But if you're supporting Warren and you're a progressive, I don't know what to say. I mean, you've seen her backtrack on Medicare for all. She barely talks about healthcare now. There's a story about that. Barely mentions it at campaign events. Like, back somebody who's actually going to fight for you.